There's quite a few patients in ED, potentially with COVID, that will need to come in and stay later.
Of course, staff have been here before, trying to find space for COVID patients as they arrive at the Royal Preston Hospital.
So will this change from a green to a red?
This will potentially change from green to amber.
With around 60 patients across the trust, it is manageable, but it's no less shocking to see how ill and how young some of them are.
Sadly, not alone. There are other people who've come in like yourself and said they were putting off getting vaccinated and come in seriously ill and then requiring admission to critical care.
And critical care is not where Darren ever thought he would be. 28, healthy and fit. He didn't even get the vaccine because he thought he would be fine.
Didn't think I was ever going to catch it. I didn't really know anybody that close to me who had COVID. I just thought it was more of a worldwide thing than a local thing.
You just thought, what's the point in being vaccinated?
And I thought, I'm young, I'll be able to fight it if I get it. It'll be a bit of flu. No, I can't. The illness is absolutely crazy.
Younger and people who have been quite fit with no medical conditions. And that's been really challenging to see them come in and deteriorate rapidly.
Dr. Manava has seen a steady rise in patients since the Delta variant took hold here in the northwest, and there is one common theme.
The vast majority of people who are getting admitted to hospital now and becoming seriously ill and going into critical care have not had a single dose of the vaccine, or some of them have had just one dose of the vaccine. There are very few people who have had both doses of the vaccine and come in becoming very unwell.
Helen is one of those. She's had 2 jabs, has underlying health conditions, and despite her at-risk category, is going home today.
I am 100% sure if I hadn't had the vaccine, I would be in a very different position. I'd probably be in intensive care.
After next week, cases and hospitalisations are inevitably going to go up because the Delta variant is just so transmissible. This hospital is doing everything it can to ensure that a rise in cases out there doesn't cause serious outbreaks in here.
Preston Royal is doing all it can to protect patients this summer. It's just hoping we are also doing what we can to protect ourselves too. Emily Morgan, News at 10 in Preston.